My name is Dr. Tina Konstantinou. I'm a naturopathic doctor focusing and specializing in cancer care. I'm also board certified by the American Board, and so I am what we call a FABNO, Fellow to the American Board of Naturopathic Oncologists. I received my training at the Canadian College of Naturopathic Medicine in Toronto. I practice in what we call a multidisciplinary practice. We are 7 medical doctors here, a chiropractor, and another naturopathic doctor who focuses on family medicine. So this is not what I call alternative medicine. This is what I call complementary medicine, where we complement the current treatments in cancer care to try and minimize side effects. One day I was sitting down and I ended up watching Dr. Oz, and I saw John Kortum as a guest on his show. And I thought this was a very interesting way of approaching the patient, because typically my patients endure quite a few invasive procedures. They're being poked and prodded. And I thought that this would be an interesting tool and method to research a little bit more detail in, because it's non-invasive, it doesn't harm the patient. So I invited John Kortum up to Ontario in the middle of winter.
What I have found working with Dr. Konstantinou is, although we are in agreement when we both perceive
Indicators.
a breast indication, there's a little bit of variance in my vernacular and Tina's vernacular. So,
No kidding.
so as I've talked about it, the way I perceive one of the breast indications is I perceive, if you look at this thick string and there's a coarseness to it, it's almost like small rope. And this is what I would perceive when I look at a woman's face in a vertical pattern. And as the breast indication increases, I perceive more and more of this fibrous structure. Okay. So as I bring the string to Carolyn's face, I perceive a vertical texture, a vertical coarseness like this. And when I blend my sense of sight with touch, I perceive beneath the skin surface. So we're not looking for contours in her complexion or skin. That's not what I'm talking about. So that is how I would perceive it, and it would often be on both sides of the face. So it would be symmetrical. Now, as I've described this perception to Dr. Tina, if you would tell us how you perceive this breast indication.
I actually see a wave that will give you those lines, but it's a wave, it's a ripple that has a depth to it in the face. So I actually see a wave that is kind of coming along this way.
So where I perceive it in a vertical pattern, for you is it more of a terrain
Terrain.
So it's a terrain all the way across.
Correct.
And do you perceive it from cheek to cheek, or does it include the forehead to chin?
I see it cheek to jawbone.
So look this way, please, Carolyn. Yes.
Although for me, I see it more pronounced. I can still see it on her left side, but I see it more pronounced on her right side.
So you're saying that there's more of an indication over here.
Yes.
Than over here.
Correct.
And would that concur with the conventional medical diagnoses for what's going on with Carolyn?
Say yes.
Yes, it would.
So it's on the right side?
Yes.
Okay.
It was on the right side.
Okay, so it was on the right side.
That's right. So I definitely see it more amplified on the right than I do the left.